pleasant day and a warm welcome, ladies and gentlemen, to your favorite show, iMed. iMed is a program where we discuss medical concerns, and today also we found a very interesting topic to discuss. We were discussing about certain disease conditions, clinical features, and more on to your information and knowledge, because there are certain conditions we have to have some sort of a knowledge in order to eliminate the causes and even to lead a successful healthy life. Today we are going to discuss about leprosy, and we'll be talking about the clinical features, management, and some related stuff related to the disease condition leprosy. And to do the honors, we invited Dr. Indira Kahavita, consultant dermatologist of the anti-leprosy campaign. Thank you very much, madam, for taking part in our discussion. So madam, as an exposure to today's topic, let's explain what leprosy is.
Yes, leprosy is an infectious disease. It's spread by respiratory droplets. The causative organism is a bacterium called Mycobacterium leprae. This organism is like in a person who is highly infectious, person who is harboring the bacilli in their face, the respiratory mucosa, that's the mucosal surface of the nose and the mouth.
Right.
When somebody is harboring these bacilli in their mucosa, when they are breathing, when they are talking, when they are coughing or sneezing, they will be putting out millions of bacilli into the environment. When another person who is not infected is inhaling these bacilli, the bacillus gets into their system. And the good thing about leprosy is about 90% of those who get infected do not develop the disease. It's only a very small minority who will develop the disease. And also leprosy is a disease which very slowly growing, very slowly spreading in the body. Therefore, like from the time you get the infection to the time that you manifest the disease, you develop the symptoms, it's a very long time. It could be years, like usually it's about 5 to 6 years, could even be 10 to 15 years.
Right.
So it's a very slowly growing disease, and leprosy affects the skin and the peripheral nerves. Therefore, it can give symptoms related to the skin as well as to the nerves.
Right.
So basically leprosy is a bacterium spread by respiratory method, very slowly growing and slowly manifesting its symptoms and giving rise to symptoms related to the skin and the peripheral nerves.
Right. Okay. So there's a small confusion, madam, that you talked about. So leprosy is a disease condition which can be spreaded through when a person is talking, sneezing, through the respiratory layers that is inside our nose and mouth and the related areas. So madam, one can conclude this leprosy as a respiratory disease. Is it correct? It is not exactly correct because it's spread through the respiratory method, but its manifestations are in the skin and the nerves. Usually, like people can develop a few symptoms related to the respiratory system, like stuffiness of the nose and things like that, very rarely, in a very few minority of patients. But in the vast majority, the symptoms are shown in the skin. Right. Okay. So when considering and talking about a disease, we bother about the manifestations, how we can identify that thing. So madam, you were talking about this disease condition, and it was slowly progressing, and it's difficult to identify at the initial stage, some sort of a confusion like that. So let's move on to the clinical manifestations of this disease, madam.
Yes. When we come to the clinical manifestations, the commonest clinical feature is a light colored skin patch, which could even look like alohang. It would look like this.
Right.
Yeah, if you can have the pictures.
Yes.
Yeah,
so this is a light color discoloration.
Yes, so you are seeing two patches. The one on the left is from the arm of a child.
Right.
You can see these light colored patches which are fairly well defined, and the other thing is a larger lesion and you can see this slightly red rim around the lesion.
Yes.
Right. So basically, these are lighter colored patches. Usually there won't be any itching, pain, no symptoms are there.
Right.
Usually if you touch them, you can feel that the lesions are dry, and if they occur in a hairy area like the leg or most of the times the leg or the forearm, you may see that there are less hairs within that lesion, right? But the most important feature about this patch is there is reduced or loss of sensation.
Right.
That is the hallmark of the patch of leprosy. If this reduced sensation were not there, leprosy wouldn't be any different from the common aluhang.
Right. So then, ma'am, what we encounter in certain other diseases, skin diseases, is we retain the sensation part, but in leprosy that is missing. So that is the what we call harm done by the bacterium that is related to leprosy. Right. So, madam, you told about that aluham condition and certain other related conditions. People try to misdiagnose this. Oh, right, I also have a patch like this. If it is a certain normal dermatological condition, people won't bother. But the thing is that when it comes to the seriousness of the disease, they tend to be scared and go here and there, do many investigations and so on and so forth. And madam, what are the closely related conditions like this?
Yes, actually aluhang can look like this, but most of the times aluhang, like now leprosy patches are there like at this size, they will remain at this size and they will remain like this for months. But aluhang over time it spreads over the body, and sometimes it can be itchy, especially after a bath or when you are sweating. Aluhang can be itchy, and usually if it is aluhang, like over a few months it would spread over the body, right? And when it comes to this hypopigmented patch, there are other things, like now what we are seeing here is a very little patch, very subtle, again in a child, right? So the lesions can be very subtle, you can miss it.
Yes.
But when it is spreading, like this is another important place I would like you to remember. This is the back of the elbow.
Yes.
And it's a very common site for leprosy, especially because this bacillus prefers cooler, like lower temperatures. So it prefers a temperature of about 32 to 34 degrees.
Right.
Our body temperature is 36 to 37, right? So when you look for when the bacillus looks for cooler areas of the body, so the back of the elbow is like it's a cooler place. So this is a common place for leprosy, and one very important thing is you rarely see the back of your elbow.
Right.
And it can remain there, and the back of the elbow is the lesion here is overlying a nerve called the ulnar nerve right here, behind on the medial side of the elbow. So that nerve is the one that does everything with your small muscles of the fingers. Therefore, if you have a lesion behind the elbow, with that lesion you may develop neurological impairment, nerve damage in the hands. Therefore, this back of the elbow lesion is extremely important. Another thing, now we talked about leprosy lesions being painless and symptomless. It's there. But especially things like the back of the elbow lesion, or if there are any leprosy lesions which are lying directly over bony prominences, like here, back of the elbow, those lesions, if you sort of touch like this, if you tap on it like this, there will be deep pain.
Deep pain. Right.
So usually you don't expect pain in leprosy, but this sort of lesion you can have a deep pain.
Right. Madam, moving on to this elbow condition, if a lesion or a certain appearance like disease in the back of the elbow, you told that to the medial side, that means to this side of the arm there is a nerve, and it will be compressing, and there will be some neurological impairments like on the hand.
We will come to the neurological impairments later.
Right, okay. So ma'am, just moving a bit to clarify this moment, if we have a lesion on the elbow, that means this type of an appearance. If we have something like numbness or something like that,
especially in the 4th and 5th fingers, if there's a numbness, you have to be very careful. You have to suspect leprosy.
Suspect leprosy. Okay, so ma'am, let's move on. Apart from these conditions which like to tend to have a certain appearance like this, what are the other symptoms that we can encounter?
When the disease is spreading, you can have larger lesions. Now here you can see a bigger lesion, and you can see now there's a big major central lesion, and it is now giving out small satellite lesions. So that tells you that the disease is spreading within your body. So that can give rise to an appearance like this, where you get large number of light colored patches. This can be confused with aluhang again, but you can see in this person the patches are a little bit redder than light color. Right. So when the now at this moment we know that the bacterium is spreading all over the body. Then it can sometimes these patches can be like you can have just one large lesion. So things like this, most of the times when it occurs in the trunk, back of the trunk, people do mistake it for aluhang. Yes, aluhang is a condition which is sort of taken as a non-disease in the Sri Lankan setting. I mean, Sri Lankans don't bother to treat aluhang. So most of the times if you ask our patients, why didn't you come for treatment? The explanation is, I thought it is aluhang. Right. So moving on from there, you can end up with lesions like this. Now you can see, now up to now we saw lesions at the level of the skin. Now it's sort of heaped up. Now it's these we call plaques, which are raised lesions, and they are now red rather than light color. And if you look for reduced sensation in these patches, the sensation is not changed. So the cardinal features of the light color and the loss of sensation that we talked about in the smaller patches is not seen in these lesions.
That means with this progression.
Yes. Now you can see again. Can I see those that picture again? Yes. Now another thing I would like to point out to you is here. Now you can see this raised lesion, but you can see especially in that very big lesion in the middle, the center is flat.
Yes.
So it's like either a saucer or like if you think of any eatables, a donut, right? It looks like a donut, especially look at the ones on the top.
Yes.
They have a central clearing with a raised edge and reddish, so it's like a donut. So this sort of donut lesions are like, if anybody has this kind of lesions, best thing is to think of leprosy rather than anything else. When these lesions are there, the person can have numbness at the hands and feet also, like all 4 limbs.
Despite of the position or the place where these lesions are available.
Yes, because I just showed you lesions from the back, but by this time the lesions are spread all over the body.
If we encounter with the time period, madam, like the early onset of a small lesion like a discoloration on the skin, for example, today I'm seeing a patch like that, so nothing to worry about. As an ordinary person, I think that it is aluham. So with the progression, what sort of a time period can we expect to the development of this stage?
I don't think we can talk about a time period like that, because sometimes, like leprosy, I mean, it's a bit difficult to explain in this kind of situation, but leprosy can have a spectrum of symptoms. So some people who have this little patch, they will just continue to have this patch. Very rarely they will, like most of the times, they will not develop any more lesions. This will be there. But most of the times, people who develop lesions like what we saw earlier, they don't start with a little patch. They come up with this because by in this situation, the body's immunity against the bacterium is very low.
Right.
Therefore, the bacterium has its own way. So it's spreading all over the body. So it like somebody with this sort of situation may, like initially also they may present with this kind of lesions,
Right.
not with a little patch.
Right.
Therefore, it's very difficult for us to think about a time period. If we move on from there, sometimes they can develop large patches like these, especially if the person is having a dark complexion. The patches may look copper colored, like what we see here, right? And
That means it depends on the complexion of the person as well.
sometimes, yes.
Right.
Yeah, especially if you are very dark, right?
Right.
And moving on, we move on to changes in the face. Now, when the disease is like sort of by the time somebody develops facial changes, the disease has taken over the entire body.
Right.
Therefore, they develop puffiness of the face. And what you see here are the eyebrows are thickened and they are kind of nodular. They are not smooth. You can see that there is a nodularity and
Yes.
and also the loss of eyebrows. Right. With that, you can develop nodules in the ears, like what we see here.
Right.
And also nodules in the chin and the lips. So this entire thing where the face is puffed up with nodules in the earlobes, eyebrows and the chin and lips, and by this time they may have nasal stuffiness or nasal voice. So this entire combination is likened to the face of a lion.
Right.
It's called a leonine face. Basically, the face changes. The face changes, and with that, most of the times they have numbness of the hands and feet, and sometimes even like because of the loss of sensation in the hands and feet, they develop ulcers.
Right.
Right? So this combination of facial change, and they may have patches in the body as well, like what we saw in the previous slide.
one. Right.
So the facial change, patches in the body and the numbness of the hands and feet, this combination is the most infectious kind of leprosy. It's those people who can infect others.
Right. Okay. So, madam, let's move on to the neurological aspect quickly, as we're running out of time also.
Right. Okay.
Yes.
So, neurologically, they may come with nerve thickening, like what we see here. The nerve thickening may be on the sides of the neck or in the inner aspect of the elbow.
This is also a nerve thickening condition.
That is,
right.
they are, what you see, the cord-like thing is the nerve, and there is a nerve abscess,
Right.
collection of pus also there, right? So that nerve is really damaged. That may give rise to something like this, where
Right, that means
the
the
nerve
fourth and
damage,
fifth,
yes, the fourth and
fingers.
fifth fingers are clawed. We call it a claw, right? Or the other neurological manifestation could be a foot drop. You
Right.
cannot raise the foot from the ankle. So if it goes on, they may end up with a complete claw like this, and you can
Right.
see that there's loss of muscle,
Yes,
there's
muscle wasting.
and also ulceration. So this person has poor muscle power as well as numbness. Right. So both sensory and motor,
Right.
both are gone. Right. So there's no point in diagnosing somebody at this point.
Right.
So what we need to do is to diagnose them early,
So
like when they are having early manifestations, like numbness in just only the numbness in the hands, only the numbness in the fourth and fifth fingers, or like they may come with difficulty in doing fine tasks,
Right.
like writing with a pen or even eating, like to eat our rice and curry to make a bath cutter. You have to bring all 5 fingers together. So if somebody says, I find it difficult to feed myself with my hand, you have to take it seriously. So if you detect it at that point and treat it, that can be reversed completely. But something like what we saw earlier cannot be reversed.
Right. That means the muscles are wasted, ulcers appear.
And if you allow it to go on, you may end up with ulcers like what we see here. And also in the picture on the right, you can see that the second toe is shorter. Now, That is because there was an ulcer, and that ulcer spread to the underlying bone also.
Right.
So that bone got destroyed, and the toe ended up being shorter. It wasn't cut off by a surgeon, it just got shortened.
So will it happen to other parts of the body as well?
It's usually the hands and feet, the digits, the fingers or the toes that can be affected like that. This is actually what was called falling off of fingers.
Yes, right.
So this is what was termed as falling off of fingers. This was a dreaded problem with leprosy. It's actually not a falling off. It is simply you have lost a sensation, then you develop ulcers, the ulcers get infected, and the underlying bone, which is like it's just the skin and bone in a finger.
Yes.
So the bone gets infected and bone gets destroyed. This can occur within a month or two. Right? So this occurs very quickly, and people think it has fallen off. Right? But it's not a falling off. If you don't allow yourself to get injured, if you look after your fingers very well, fingers and toes, you can avoid this.
Avoid that. Right. Okay. So madam, when considering all those things, so when coming to this type of a stage, it's difficult to reverse back. So any other treatment modalities initiating with investigations that we can follow up?
Actually, there is no specific blood test to diagnose leprosy. It's mostly a clinical diagnosis.
That means with these features only we can conclude.
Yes, any doctor who knows about leprosy can come to a diagnosis. There are certain tests we can use to support our diagnosis, like there's a bacterial test called skin smear, where you take a bit of tissue fluid from the skin and look at it under the microscope. That may be positive in patients like the one with the facial change or the large patches in the skin, but the small patches, that's going to be negative. Sometimes we do a biopsy, but not always. So most of the times it's a clinical diagnosis, the doctor diagnoses. No blood test to confirm the diagnosis.
Right. So quickly ma'am, let's move on to this drug therapy related with this.
Yes. Now leprosy is curable completely with drug therapy. Since 1983 we have been receiving this treatment called multi-drug therapy or MDT, which is given free of charge by the WHO. So what we are seeing here are two packs. The one on the blue pack is for children and the green pack is for adults. This treatment is given for persons who have 1 to 5 skin lesions. Right? And we give this treatment for 6 months.
6 months.
Yeah. If you have more lesions or a positive bacteria in the skin, we go for this treatment. The brown one is for children, the red one is for adults. It is for a minimum of 12 months.
Right. Okay. So with this treatment thing, and ma'am, just quickly, shall we outline within 1 or 2 lines the WHO interference with this related disease condition?
It's actually WHO has developed guidelines to manage leprosy, and WHO is providing this treatment free of charge to all countries who are having reporting cases of leprosy, and also about disease control, and all the work is, most of the things are guided by the WHO.
Right. Okay. So thank you very much, madam. We discussed about leprosy, the clinical features, management, and we had the exposure for some pictures as well. So ladies and gentlemen, if you diagnose this type of a condition, so you can't wait longer, because certain conditions will develop rapidly within the course of a month or 2. So you must be alertful with your health. When considering the skin, it is one of the most vital parts of the body. It matters about appearance as well. So you have to concern this thing, and hope this program was finding interesting for you all. So thank you very much, madam. Dr. Indira Kahavita, consultant dermatologist of the anti-leprosy campaign. Thank you very much, madam, for taking part in our discussion. So stay tuned for more programs in the future as well. We'll be discussing some continuations of leprosy as well. So thank you very much for watching. Have a pleasant day, and this is iMed, your favorite medical discussion.